Hi, I'm Benjamin Levy, a gastroenterologist at the University of Chicago. Here are 10 ways to improve health communication with patients. These tips will place patients at ease, increase adherence to recommendations, and make the doctor's visit a lot more fun for patients. Tip number 1, be an active listener and help guide the history-taking process by asking clarification when needed. Quickly figure out the patient's chief complaint. Which symptom is the most severe? Ask the patient for symptom-modifying factors such as onset, duration, frequency, as well as a pain description. Is the abdominal pain sharp or crampy, dull, achy, or pressure-like? What makes the symptoms better or worse? As many of us were taught in medical school, 80% of the diagnosis is in the patient's history and description. What can we do to help elicit an accurate history from the patient when the patient is not providing the needed information or being helpful enough? The easiest way is to ask your patient in a completely different way, but one that resonates with the patient. For instance, ask how the abdominal pain is affecting their quality of life. That will help focus the history taking and encourage the patient to share details. Does the pain keep them awake at night? Are they able to eat a normal size meal? Or are they forced to eat little tiny snacks? Is the pain interfering with their work or school? By providing a framework to their history taking, the patient will be more passionate about sharing the history details. Sometimes patients provide details in a non-chronological order, jumping all over the place. A super helpful technique is to explain to the patient you have a story to write for your computer note, or for them to think back to when they first started noticing their abdominal pain or rectal bleeding symptoms. When were the most severe episodes? How frequent are the episodes? What's the volume of your rectal bleeding? If the patient realizes you're trying to write a story synopsis, they will provide information in a much more organized way. Quickly determine the patient's language preference. We want patients to feel extremely comfortable. Whenever possible, use a certified interpreter. Language phone lines, in-person interpreters, and video conferencing are widely available today. It's worth investing in this technology so that we can provide the best possible care to immigrants and refugees. Avoid using family members as interpreters because they may not be adequately trained in medical vocabulary. When providing explanations, use simple language that your patient can understand and identify with. Use analogies like the heart is a pump, or the diverticular or thin areas of the colon that can bleed if a blood vessel is too close to the surface. Determine your patient's level of medical literacy. Some of our patients did not graduate from high school. Some patients can't read very well. So your discharge instructions and handouts should sometimes be written on a third grade level. If patients can't read, write medication instructions with symbols. Draw a sun for medications that are supposed to be taken in the morning, and draw a moon if the medication is supposed to be taken at night. Very carefully review the instructions with the patient. Frequently check in with the patient to make sure they understand what you're asking or what you're trying to explain to them. If the patient is accompanied by a family member, help them serve in the important role as a patient advocate. If the family member wants to take notes, encourage them because that's awesome. Sometimes patients can forget clinic and hospital medical conversations, and that family member might be the key to improving your patient's health. If your clinic has the capability, follow up with the patient the next day to make sure that they understood everything. Check to make sure that the patient was able to pick up all of the medications that you prescribed and get labs drawn, as well as get procedures such as EGDs and colonoscopies scheduled, and get important imaging such as ultrasounds and CAT scans scheduled too. Have fun talking with the patient. Find out what they do for a living, build rapport, and listen to their stressors in life. Try to identify any barriers to care or external stressors like taking care of a sick parent, which might interfere with them scheduling an important diagnostic colonoscopy for rectal bleeding. Now, good luck incorporating these communication strategies into your clinic and hospital work. Together, we can help improve the delivery of healthcare.